Welcome to our very first Facebook Live event to cover the COVID-19 situation. My name is Dr. Annette Mercatante. I'm the Medical Health Officer of the county and the head of the Clair County Health Department. And we have with us as well.
And I'm Justin Westmiller, the Director for Homeland Security and Emergency Management here. And Doc and I are working together to manage this incident countywide.
So we've been receiving lots of questions. Obviously, everyone has lots of questions, sometimes more questions than we have answers, but we're here today to answer your questions. We'll start out with a brief review, and then as the questions come in, we have staff here that's monitoring the Facebook page, and they will ask us those questions, and we'll do our best to answer them. So, first of all, I want to share that we have been working very hard since the very onset of this, keeping up with both national and state information, guidelines, as well as our own local response. As we identify new cases, we have been trying to compile them and put them in a system way that is meaningful to everyone. And you may have all become familiar with this page, which we indicate total counts. We started to include hospitalizations several weeks ago, the total deaths, as well as the number of people who recovered. There are more people recovering than there are in the hospital. So data, I just want to be very clear to you, has been an ongoing source of confusion. And as we talk about this, I want to try and relay a very important piece of information. Numbers are just one tool that we're using to try and identify and understand what's happening to us locally. These numbers don't represent actual numbers of everything that's going on. This information is not final. In many situations, we get the information, the data, after it's all been completed, reviewed, scrubbed, details removed. In this situation, we're providing you numbers that are actually real time. This is information that we receive in the last several hours, sometimes in the last day for sure. And we release it to the community in the sense of transparency, but also in the sense that you have to understand that these are not final numbers, which is one of the areas of confusion, why it's changing, why it's different than the state. And when we get to that question, I'm sure we're going to get that, I'll try and explain to you how we come up with these numbers and what we hope they convey to you. And more importantly, what information you should get from them as you look at these numbers coming out. Do we have any questions yet? Okay, so let's go to the second part of information that we started reporting earlier in the week. This comes from, so these numbers come from our direct investigation of cases. When I say our, I mean the St. Clair County Health Department. We have a team of nurses and specialists who receive information through a state surveillance system, through hospital data, and through other direct reporting to the health department, where they put these numbers into the system and then they directly call people and identify and confirm whether they are a case or not. This is a direct one-on-one interaction. Some of these calls can take several minutes to much, much longer. And through that interview, our nurses can also identify who's at risk for exposure and what actions each one of these individuals needs to take. This is not a cookie cutter, simple explanation. Each case is obviously very unique and different. And so these numbers are direct information from our staff to the individuals in the community. Painstaking work and very, very important for us to understand how things are going. The second set of numbers are derived from a statewide system where both hospitals and nursing homes submit every single day, generally by noon, a number of situations, how many beds are available, how many ventilators are available, how many people are utilizing the emergency room. And now this system includes very specifically the number of COVID patients that are hospitalized and on ventilators. So this information is pulled so you can see at a glance really what our capacity is at our hospitals. And again, it doesn't matter if there's 42 or 45 people in an individual hospital. What's important is what our overall capacity is. And that's why we're presenting it in a percentage. This is, by the way, a combination of all three of our hospital facilities. River District, Ascension River District, Lake Huron Medical Center, and McLaren Port Huron. So this is a aggregate number as well. But that's important because if we have the need to hospitalize COVID patients, we are going to look throughout our county. We're not focusing on one particular agency or one particular, this is a community-wide event where we're really trying to make sure everybody gets what they need working together. And then finally, we break this down into what we call demographics. Demographics means the type of persons who are getting sick. Are they male? Are they female? What their race and ethnicity is. We do some demographics based on location. Everybody did want to see where these cases were occurring. And I want to just share one of the reasons we didn't take this right down to zip code levels and smaller levels is because we want to be very conscientious about not identifying people if we don't have to, as far as them what disease they have. This is a sensitive personal health care information and matters, and we're trying to spread it out so that you don't know whether your next door neighbor is the person who had COVID or not, for obvious reasons, and I think you can understand that. So when you look at this map, you can see a couple things. And again, the numbers are not what's important. What's important is to see where they're trending. Okay, so in our rural areas, you can see that they remember they're somewhat sparsely distributed, but we have cases in almost every community. But when you get into cities, you'll see higher numbers. And then when you get into our villages, you'll see somewhat higher numbers. And that's just because more people live there. And then when you get into our more highly densely populated community along the shoreline, that's where you see our greatest numbers. And that's because that's where most people live. This virus doesn't really care what your lifestyle is, whether you're rich or poor. It does care whether or not you're close enough together for that virus to jump and spread. Okay, so you'll see the hot spots continue to be in these areas that are heavily populated. So that's what this map is intended to show. And then finally, you'll see these maps that we have changed and rechanged a few times. People were very confused when we were showing individual numbers, and those numbers would sometimes change when our staff got into the system and started talking directly to people. They would identify some of these people in our system as not being part of the county or being not necessarily a case. So these numbers are not final, but what's important is that you can see there was a very steep incline here, and then it's tending to settle down a little bit. It is too soon to say whether we've reached a plateau or if we're down. But I can definitely tell you we're not seeing the steady increases every day that we were a couple weeks ago. Along with this map, you'll see the people in recovery, and you can see that there's a steady increase in recovery. Again, the numbers are important because people are put into our system as recovered, as our staff communicates with them and goes through all the variables that would identify them as recovered. So that happens, but it happens as our staff gets to it. And so, because their first priority, by the way, is to identify the cases. So this recovered piece is a little bit more erratic. But again, important is that it's going up as it should. And then finally, and these are all, by the way, on your face on our website, scchealth.co. And we are posting these as well every single day. So again, the final graph is, again, the total number that is included under this blue. And then we have the hospitalized cases, which you can see has become very flat. And that's a very encouraging number, because whether or not we're finding all of the people with COVID out there with you guys, it's of question, because you know we have not had expansive testing. I'm pretty confident we're finding the number of COVID cases that are ending up in the hospital. And that's because our hospital staff has an opportunity to directly see these people and test for them. So to see a somewhat flattened curve of hospitalizations would suggest to me that the cases are pretty steady as well now and not increasing. I think that's a very, probably the most reliable indicator that we have as far as how extensive the cases are. And then finally we have the deaths. And deaths are extremely variable because people don't just get COVID and die. They get COVID and they get sick, and then they recover, and they relapse, and they go on ventilators for long periods of time, and it's extremely variable. So you might have a period of time where there's hardly any deaths, and then we'll have kind of a bad couple of days where some people do succumb to the illness. And so deaths, as important as they are, I think some of these other trends are more important as we look at where we're going. So we have a question.
We have 2 questions.
Okay.
First question, what are you doing to protect the nursing homes and senior housing?
Okay, that's an excellent question, and it's a very, very important one. So the question was, what are we doing to protect our senior living centers and our nursing homes? And it is a very important question. And there's a lot of work going on statewide to try and establish some consistency. One of the things we did very early on as a health department is we brought in all of our long-term care facilities, their leadership, especially their managers and nurse practitioners and infectious control people. And we brought them all together to discuss what their needs were, where their gaps were, and we did everything we could to establish smooth communications, so we all knew how to communicate with each other. Those conversations continue on a weekly basis. We've been very proactive, making sure that they have the proper PPE, making sure that they are very clear about what the current guidelines are for their staff, and we are assisting them in every way we can to provide them resources for testing and to continue to follow the best guidelines we can for keeping their staff as well as their residents safe. It's a difficult situation because they can't just all go to their room and be alone. As you know, the congregate settings have unique challenges. But I want to say that our long-term care facilities have been tremendous partners, and they're communicating very well with everyone involved. And we're hoping to see better outcomes because of that.
Next question, do we have testing here in St. Clair County?
Well, of course we have testing. That's where this information is coming from. What we have not had since the onset is unlimited testing, as you know, the rest of the country has not as well. Testing remains challenging. We do not have unlimited testing for everyone who wants it. But very slowly, the testing has expanded to include people who are ill, especially people who are on higher risk groups. So what we don't have is drive-through for everyone who wants it, but what we do have, and had from the beginning, is testing that is available for anyone who has a doctor's prescription. That means you have to speak with your doctor first. You don't necessarily have to go to his office, his or her office, but they have to allow you that discussion and provide you with a prescription. Once you have that prescription, you call the Lake Huron Medical Center, or now McLaren has a similar setup, and you can do a drive-through up to their lab on a curbside basis where their staff comes out, gets the test from you, and you drive away. That's been the model that we've been using from the onset, and the limitations have honestly not been staffing. It has been the ability to get enough test kits, swabs, and reagents to do the testing, which is why we've kind of opened this up by priority level. So first priorities have always been people who've been hospitalized, which is why I mentioned the hospitalization data is probably our most reliable data. And now and then we were always opened up to people who are higher risk, people who are elderly, people with chronic diseases, and our first responders, our EMS workers, our firefighters, our police officers, people who are essential to keep the workforce going. And I can tell you that in the last several days, that has now been expanded to almost everyone, with the caveat that we have to be able to do the testing of the highest priority people first. And until we get there, we will not be able to test anyone who wants it. But we're working on it, and I hope we'll get there. Yeah. Justin.
And so we are working very diligently with our state partners, with some of our community partners, to get as much testing capability as possible, just as soon as possible. And once we get that plan, we're going to be able to roll that out to the community. I know that between Doc and I, we were on the phone furiously here the end of last week and all yesterday, trying to meet the demands of the community and meet the requirements of the state. So just as soon as we can get those test kits, the swabs, all of the requirements and all of the physical needs that we have to meet your needs, we are going to do that. And as soon as we can do that, we will get back to you on that.
We also had, excuse me, 2 questions kind of related, people wanting to know about if you think you've had this virus before, can you get antibody testing, or will antibody testing be coming to our area?
So the question is about antibody testing. And antibody testing is going to be a very, very important tool. The idea is that if you've been previously infected and recovered, you will develop a certain set of antibodies that hopefully will allow you to be protected against reinfection. Now, the problem with the antibody testing currently is this. There's only been a few emergency use authorizations to antibody tests. There are currently only 3, and they are only allowed to be used in something we call high complexity labs. So there are a whole bunch of antibody tests out there that are being sold without FDA approval. And the problem with those is we have no idea of their reliability, their sensitivity, or their specificity. These antibody tests are not intended, nor will they be used to diagnose cases. And that's very important for me to reiterate. Antibody tests cannot be used to diagnose whether you have COVID or not currently, because we don't know how long it takes for you to mount an antibody response. And we don't know how protective it really is. So the simple answer to your question is yes, we're going to start using antibody testing as soon as we have the availability of FDA approved testing, but it will be another tool in our toolbox, and it will only be part of what we use to try and protect the community.
Next question, if you had COVID-19, can you come down with it again?
The simple answer is we're not 100% sure, but it does not appear to be commonly reinfecting people. There's been a few reports, case studies out of some countries where people were diagnosed a second time, but of course that has not been well researched or documented in a way that I can tell you was truthful. So we need to study it more. We honestly don't know the answer, but I would say for the most part the answer is it does not appear to be transmitted a second time to the same person. Just like COVID does not appear to be transmitted readily through inanimate objects. And we talk about how long the virus is on things, but really we don't have any evidence that it's transmitted through groceries or some of those things. It's primarily a person-to-person transmission.
Just something about the numbers again.
Mm-hmm.
Why are our total cases different from the state of Michigan?
Okay, so our cases, as I explained to you, are real time. They're not final, but they are actually extracted directly from the surveillance system that we use and that the state uses. By the time that information is transmitted to the state, that number has been shifted and adjusted. And of course, the second big reason is that the state pulls their numbers at a different time. So we're all using the same system. We're all using the same case definitions, but it's our staff that are working directly with you and the people who are being tested to put the information in. The state then will pull the information later on. And so it's just really a matter of when they do it and the fact that they're second removed from the direct investigations. In 6 months' time, our numbers will be exact, okay? And that's the problem. You're not getting final numbers. You're getting real-time information as it's extracted from the community.
And I refer to it as a battle rhythm issue, right? So we are on the front lines of this, and so we are having a much better time because docs, nurses are really managing this data from a immediate standpoint, and the state is 1 level removed or 2 levels removed, and so they're really just pulling it from a database and pushing it out at a 6 or 8 hour difference, or a whole day plus 6 hour difference. And so there's just a data disconnect at a macro level where locally we have a much better grasp on the data, and so our data is just a little bit better than the state's, and we have a better understanding of what our numbers are, if that makes if
But
that makes it easier.
another really good example of why the difference between 291 and 287 really doesn't matter that much. The importance is whether we're going up or down. The importance is how we're handling our resources, how we're providing services to all of you, and making sure that we understand how these are trending. So whether there's a case missing here or a case missing there shouldn't trouble you. We'll get there. We'll eventually account for all the cases we know of. But right now, the importance of these numbers is to see where we're going.
How many days with zero, you want to repeat the questions too? So
Yes, I'm sorry. Yeah.
How many days with zero symptoms do you consider someone fully recovered?
How many days with zero symptoms do we consider someone fully recovered? That's a loaded question, and we're learning a lot about this infection as we go. So the official guideline is if you have gone 7 days from the first day, we call it the onset of your symptoms. So you feel sick on Sunday, and the following Sunday you feel better, and you've had 3 days of consecutive days in a row with no fevers, without taking anything to reduce your fever, we are using that, what we call a clinical definition of recovery. Okay, so that 7-day, 3-day rule. There is also a testing definition for recovery, and that is you have 2 negative swabs, the NP swabs that we're doing to test, 2 negative ones 24 hours apart. Now that testing definition has not been used in actually hardly at all in our community, because we don't have the testing capacity. And we don't want to use those tests to diagnose somebody recovered when we really need them to make sure that we diagnose the person in the first place. So that's going to be another thing you're going to see changing, the definition of recovered, as we have more capacity. Now the state uses a 3rd definition of recovery. And they do this because they have access to a huge database called Vital Statistics, which is death certificates. They use a 30-day model, which means they compare deaths and their Vital Statistics database with the number of cases 30 days later. And those that haven't died, they're defining as recovered. That is a system that they came up with. It works for them. It's not a system we could use. A 4th definition of recovery. Think you're confused. We're staying with this. We're with you. The 4th, if you are not symptomatic and for some reason do have a test that shows the virus, we're suggesting 10 days of isolation in somebody who doesn't have symptoms. And of course, the big thing is that if you've been exposed to somebody who you think has COVID, and you're not sick, but you know you're exposed, you're living in the house with somebody who's got COVID, or they're a close partner, you're supposed to stay quarantined for 14 days. That's because we think you'd be sick by then if you're going to get sick. The incubation period is somewhere between 2 to 3, 4 days, and probably about 12 days. So if you stay isolated or quarantined for 14 days and don't get sick, we're assuming you didn't get infected with that exposure. So those are all days that can get really confusing, and this is what our staff does at the health department. They call you when you are positive. They walk you through when you might get released. They make sure you know when you're released. They release you, okay, from isolation. Our staff will talk to you and say you are no longer in isolation, and they will identify who the people are that have been exposed to you and how long they need to stay in quarantine as well. So I know it sounds complicated, but we have staff that's going to be talking to you directly and helping you make those decisions. I hope that's clear.
Somebody said that virus has been found on shoes. Because you hear a lot about people taking their shoes off.
Okay.
So why would it not be on other objects? You had mentioned about the grocery stores.
Well, of course it's on other objects. So what you're hearing are just tests and studies that people do. So somebody did a study where they took a bunch of shoes and they swabbed them and they found a virus, okay? There's probably going to be hundreds of thousands of tests like that. We also know that the virus stays a certain period of time on objects, plastic, those studies have all been done. So the virus does get shed by somebody who's sick. It lands on something, And if you touch that something and then touch your face, it can infect you. And I would assume that any object that has been near a person who's been sick could have virus on it, which is why we want you to clean things regularly and wash your hands and don't touch your face. It's also why we want people to wear masks, because you could be shedding the virus and not know it. And so if you have a mask on, it's one more barrier. So whether it's a shoe, a grocery bag, whatever, assume there could be virus on it and take the precautions you need to avoid touching it and then touching yourself. With that said, again, the most direct way of getting infected is being near somebody who is shedding the virus person to person. That is what we know causes most infections. Okay?
Next question. This person wants to know if someone who worked at a senior facility, either a staff or a resident, and they test positive, is everybody tested?
Okay,
What's the process?
so the process for long-term care facilities at this point, up till now, and this is changing, is if they tested positive, they would be sent home. We would identify who the exposed people with that person are and monitor them closely. People who work at healthcare facilities as a whole are allowed to work if they're not sick. And if they have an exposure, they're monitored very closely. So that's been the model. I can tell you that where we're moving to, again with increased access to tests, is to test more aggressively throughout the facility. We're not there yet, but we're working on it, and that is a second phase of trying to contain this. So it's a good question.
Now, this is a rumor question.
Okay?
Somebody had heard that some of the test swabs were contaminated with coronavirus. Is this true or false?
Oh my! I've never heard.
I haven't heard that one either.
Yeah. So the question is a rumor that some of the test swabs were contaminated with coronavirus. I have absolutely never heard that. I would be extremely surprised, since we get these resources from the type of lab that sends us all things medical testing, and the swabs are not in a big bag. They're individually wrapped. They're done by healthcare professionals, nurses, and people that you trust your life with every time you go to the facility. So I would think that's a rumor, to be perfectly honest with you.
Someone also said they can't hear the question, so if you could repeat
Okay.
each one again. Next question. Are most of our cases concentrated in one area?
Do you want to handle that?
Sure. So most of the cases concentrated in one area. So let me just flip back to this, and you can plainly see.
Yeah.
So.
Where's Vanna White when we
Yeah,
need her,
right.
right?
So in our county, you can plainly see that we have pretty widespread community spread of the disease in our county. So the short answer is no. It's not local. It's not localized in our county. We have widespread community spread. So we've been kind of dealing with that for probably the last 4 to 6 weeks, right? At least. So no, it's not localized, and we continue to see it in all areas of our county, pretty much.
So in other words, you can't identify your risk, your personal risk, by looking at a map like this and seeing where the cases are. Once it is widespread, that means most of our cases are occurring with no known exposure. We do not know where this person got it. It's just out there. And so having an idea that, I guess this would be, I don't know, Marine City. Here's Marine City, there's 8 cases. And somehow you're safer in Marine City than you are in Algonac. That's just not true.
Right.
And so that's why, again, I want to emphasize that numbers can be very misleading. This virus is widespread. It's in human beings. You don't need to be fearful of your shoes. You need to have social distancing, continue social distancing with other human beings. It's spread from human being to human being.
And like Doc's saying, this goes back to our whole stay home and stay safe executive order. That is right now
What is saving our lives?
Right. It's one of the biggest tools we have to keeping our community safe, that and social distancing. If you have to go out right now, please only go out for the essential items. And when you're doing so, wear the proper protective gear like masks and gloves and wash your hands and do the things that you need to do to be safe. Just be aware of your surroundings and do what you need to do to protect yourself and to protect your family. Especially when you re-enter your home, make sure you do, like Doc said, wash your hands, and pay attention to what you're bringing back into your home.
Next question, how can someone test positive, then it is said to be a false positive?
So the question is about getting tested, being positive, and then being told it's a false positive. There's not much false positives going on out there. The tests are pretty sensitive or specific that way. So just like influenza swabs, if you're positive for influenza, there's a great likelihood you really have influenza, and this is true for COVID. The problem is the false negatives. That means if you have a swab and you test negative, that does not necessarily mean you do not have a COVID infection. And there's lots of reasons for that. The actual testing that they're doing right now at the state and most of our hospitals are pretty good tests, but sampling can really be misleading. If you don't get a good sample, if you're at the wrong time of your infectious period, then that result can be negative when you really have a positive. So the false positives, I would be very careful to identify something. I have not seen one yet that I thought was a false positive. If it's positive, you assume you're positive. Okay?
Another, this is a flu shot question.
Okay.
So I had heard if you had the flu shot, you will test positive. Any information on that? And then the next person asked, any truth to people that had the flu vaccine showing false positive?
Okay, so the question is, how does the flu shot impact this COVID situation or the COVID testing? And the simple answer, it doesn't. It doesn't have any impact on your testing, and it doesn't have any impact on whether or not you're going to get COVID or not. There's no cross-reactivity as far as we know from the antibodies you would develop from a flu shot to getting the infection COVID. They're two completely different germs, okay? So they're not related. What we were saying back during flu season, which is now thankfully on the downswing, but as this first started up, we were in the very heart and soul of the heavy flu season. We were widespread, which means, look, don't get the flu while this COVID's going around. Get your flu shot. At least you had some protection against influenza. But there was no direct relationship between the shot and whether or not you got the COVID infection. And there still doesn't appear to be any link as far as we know.
Next question, when do you expect testing to be up to capacity? When will you be getting the needed test? Is there a date?
The question is, when will be up to capacity? I'm going to let Justin finish this, and I just want to say a couple things. The most important is, what does up to capacity mean? Okay, so that's a really good question. I would like to get to the point where we can give anyone a test who wants a test, and I think that will be probably in a factor of weeks, not days. But I also want to say that I think we're at the point now where we could test almost everybody who needs a test at this point, and that will be improved in a matter of days.
So I agree with that. I appreciate your optimism on that, and I am furiously working to meet her optimism. Again, what I say to that is, we are in a global pandemic that has really impacted the supply chain globally, and it has made it very difficult to get certain supplies, especially those supplies that everybody is trying to reach into and grab and pull from. And testing supplies are one of those very, very challenging supplies to get. So I am doing everything I can to meet Dr. Mercatante's needs on that and to meet the county's needs on that. Our goal right now is to do everything we can to meet the needs to get our economy in St. Clair County moving at a pace that is some sort of new normalcy. We will not be there in the next few days, and I know that that is painful. We hope that that will be weeks, and I'm making phone calls today. I'm going to ask some new friends to help me with that, but
We're trying.
we are trying very hard.
Now, two more things about testing. Number one, successfully reopening our economy is clearly connected to our ability
Yes.
to test workforce and to test people. So that's a really important component. So you will know as quickly as I know, because that's going to be tied as far as how we're going to open up this community. And the second thing is this community is a catch-22, being right above the whole southeastern Michigan
Yes.
blowout. But we have relatively few cases compared to the thousands and thousands that they have accumulated in Macomb, Oakland, and Wayne County. And the state looks at that when they're allocating limited resources. They're looking at which communities have the most numbers and are prioritizing resources there. So we've been a little bit on the shy side there, just trying to convince those who allocate these resources that we should be on the receiving end. And Justin is a force to be reckoned with, and we're glad that he's on our side.
So what Doc's talking about there is we are number 10 in the state for cases currently with COVID-19. And so it's my opinion, and I know it's Doc's opinion, that we should be seen as somebody who needs to get a decent amount of the testing kits and the testing capability in the state. And so we're really pushing hard at that. I see one of the questions here is, and I'm kind of jumping ahead a little bit, but antibody testing and what will that mean for vaccine and natural immunity? Well, those are some of the questions that we don't actually know yet, because there's a lot of data to be studied, and I know Doc will talk about that when she actually answers the question, but there's a lot of unknowns, and so we're still medically trying to work through what does all this data mean and how do we manage that versus what does our testing plan look like. And so I will kick it to her when our staff actually pushes the question, but this is just one facet of what we're working through here in the EOC. As you can imagine, it's a very complex situation. And so I ask our community to just bear with us a little bit as we deal through this complex situation. And I know everybody at home is really chomping at the bit because this is so difficult. And I thank you all for your patience. And so I'll turn it
Next
back over.
Next question.
All right. What about pregnant women having babies in the next few months?
What about pregnant women
Having to go to the hospital where there's a lot of germs? Any
Right.
extra precautions?
Okay. Pregnant women who have COVID or who may be exposed to COVID, a real unknown factor. Not a lot known about the impact of this infection on a mother, her babies. However, I have had several conversations with our birthing hospitals. They do have protocols and policies in place to keep mothers who are delivering and their babies as safe as possible. Many of them are working one-on-one with their obstetricians about testing. And all I can say is I feel that between your obstetricians locally and the hospitals that they're delivering in, that they're doing everything they can to protect you. The good news is, at least so far, with the very, very limited data we have, there doesn't appear to be any profound impacts on mothers or babies with COVID, more so than the general population. But there's more to come with that.
Back to the groceries.
Groceries.
Somebody's asking, do you really need to wipe off all your groceries with the disinfectant wipes, especially boxes, and how do you do that?
So the question is, do you really need to wipe off all your groceries? And actually, I made that suggestion at one point with our Facebook, because what do you do when you get all these groceries that have been touched by I don't know how many people? So the real question is, can you wipe off all your groceries? Personally, if you can, I don't see why you wouldn't. It's just an extra factor. But I did recently see some studies that would suggest that just simply putting groceries away and then washing your hands very carefully after you've touched your groceries is adequate to prevent transmission. Because let's face it, the germ's going to die in your cupboard as well, as long as you're not touching them for another day or so. If you're going to use something immediately, though, I would still like, your milk that you're going to put in your refrigerator and then grab an hour later, I would just wipe it down. But there's really no real absolute data to guide us on that. So use your head, common sense.
And at the end of the day, hand washing is still the number one defense against this disease. So, like Doc said, if you're worried about it, wipe it off. And when you're done, wash your hands.
The next question is, why are results taking so long? I was tested last Wednesday and I'm still waiting.
Okay, the delays in testing are because of the lab capacity. Now, we were watching anywhere from 1 to 2 days to 7 days or more. I'm disheartened to hear that the person is still waiting for almost a week. But this is completely out of our hands. This is based on the lab's capacity. We have some private labs that are doing it, and I can tell you it's not because the test is sitting on a table somewhere and not being sent. I know that these specimens are being sent every single day, and that as soon as the results come back, staff is working to contact people. So it goes back to the capacity of the labs.
And follow up with your provider.
Call them back.
Yep.
And make sure you didn't get lost in the queue. Results are supposed to go back to the provider who ordered it. So if your physician or PA, whatever, ordered the test, give them a call and make sure it's not sitting in a queue somewhere waiting for you to be told.
Okay, next question. Why do we not subtract the number of cured cases from the total number of cases?
Why do we not subtract the number of cured cases from the number of total cases? Well, we could. It's just another number to do. I think visually.
I think at the end of the day, we still want to know the total number of cases we had in the
Right.
county.
So here's the map showing recovered, and I mentioned to you earlier that recovered is a sticky definition that can vary a lot, and it requires our staff, the health department staff, to talk directly with you or the person who has the case to determine if you're recovered or not. So the numbers can vary a lot. So we go back to the idea that what does that number actually mean to you if one day it's one thing and the next day it's another? What it should mean to you is that the recovered cases are going up steady, and you can see the gap between that and the total is remaining pretty steady. So, and hopefully we'll see that increase, but this is probably going to stay steady. So if you want the number, you can subtract it yourself, or we can add yet another number to the graph. But the number of this is recovered, this number here, and the number who are still under the active phase is right here. And I think it's pretty self-explanatory. There's more people recovered than there are that are still in the active category. And I hope that's adequate. And again, I just go back to these numbers and what do you hope to understand by the numbers. And if there's something you don't understand, let's talk about that. Go ahead.
How long does it take to recover from COVID, and does it just affect the lungs?
Okay, that's the question is, how long does it take to recover from COVID, and does it affect just the lungs? So let's start with duration of recovery. It varies a great deal. Maybe a question is, how long does it take for you to stop shedding COVID? And we don't even understand that completely, although we do know that the most COVID is shed out of your nose and through your mouth, usually within the first few days of your symptoms. So you're most contagious right after you become symptomatic. But some people can shed the virus for a fairly long time. Some people stop shedding it pretty quickly, just based on the test. So that's one question, how long do you shed? And we don't know, but I would say for the most part, people at the end of that 7 to 10 day period are not shedding. I have no solid data to share with you on that. The research has not been done. The numbers are not final, okay? The second question, though, is how long does it take for you to recover? And I'm assuming that means feel better. And that varies a lot as well. Some people will hardly feel sick at all and will just bounce right back. And we have some people who remain sick for weeks and weeks. This isn't a quick virus. This is not a 24-hour bug. People do seem, when they do get pretty symptomatic, they seem to drag for a week or two. That does seem to be the standard that I'm seeing. What, there was another part of that question. What the other part of that question was?
Does it just affect the lungs?
Oh, does it just affect the lungs? That's a really important question, and the answer is probably not. What is striking about this virus, most coronaviruses will just stay in your nasal passages and cause kind of a common cold. This virus has the ability to attach to the alveoli, the lung air sacs in your lungs, which is what makes it so potentially dangerous. But we are starting to see some evidence come out that it can also affect other parts of your body. People who get really, really sick have multi-organ impacts. And so more to come, but it primarily affects the lungs, but probably affects other parts as well.
Okay, we've been going for an hour, so we'll
Okay.
take the questions.
You've been going for an hour?
Yeah.
Time flies when you're having fun.
That's what I was just thinking.
Let's answer a couple more, and
Okay.
then we'll do this again next week.
I think this is great,
Yeah,
and
this
then
is
we'll
great.
do this more. I think this helps.
So you already talked about antibody testing.
Right.
However, somebody was wondering, will people need the vaccine if they have natural immunity once the vaccine?
Oh,
Oh, yeah.
So the question is,
Yeah.
if we get to the point where we have antibody testing and it's reliable and we know what it means, so those are the three things. Will we get it? Is it reliable? And do we know what it means? So we have to get there. But if that's the case and you have been identified as someone that has a convalescent antibody, it's called an IgG, and then we get a vaccine, would you still need the vaccine? God, I have no idea.
Right, we
It depends on how confident we are that your antibody, your natural antibody protection, is in fact protecting and how long it will last. That's the other. We don't know how long that protection will last. And we also don't understand actually what this vaccine is going to be like. Is it going to be, as you know, some of our vaccines are not long lasting and they protect people. So I think it's just too early to really call that.
Yeah, we don't know if this is an annual. We don't know if this is a one-time.
Will the virus
Right.
mutate? All right, that's another concern they're watching very closely to see if the virus changes in a way that immunity that you might achieve now from an infection won't protect you in the future as the virus changes. More to come. We just don't know.
Okay, we'll do a couple more questions and then we'll
Okay.
close. With an eye toward reopening the economy and avoiding a second wave, would masks be advisable for a few months?
Mass is in church?
Mask.
Not
mask.
masks.
I'm sorry.
The question is, will masks be advisable as we walk through this very important and sensitive area of reopening our economy? And my answer to you would be yes.
Yeah.
Okay, yes. So when you do all the numbers and the math and we extrapolate what we know and what we don't know, I'm looking, and I think this sits with what a lot of the country is assuming, that anywhere between, in places that are hit like us, maybe 4 to 5% of the population has actually been infected by this virus. That means most of you, most of us, have not been infected. Even if that virus, that infection, gives us antibodies to protect us, most of us are still vulnerable. So when we start going out and about, you have to realize that the majority of us are still vulnerable to getting this infection. We are not out of the woods yet. So all those precautions, mask, hand washing, cleaning, all still a go. It's probably going to be a go for a long time, people. This is not going to be a short thing. We're going to be talking, I think, for a very long time about what you need to do to protect yourself.
Okay, last question and then we'll do closing remarks. To clarify the hospitalization number,
Yes.
is that real-time people currently admitted?
So it is real-time, people, cumulative. Right, Anthony? Okay, so that's total hospitalizations. And then every day,
So this number
Okay.
is real time
right, so 73 is the total number of people who've been hospitalized, including right now.
throughout the incident. Yeah.
Okay, throughout the incident. But people are coming and leaving the hospital constantly. That's another one of those things that people want to know. How many people are in the hospital today? And the reason we're not doing a number there, because it's going to confuse you all, just like all the rest of the numbers, in the sense that that number is changing constantly. So instead, we're going to report what the percentage of people are in the hospital that have COVID. So you can see right now, as of today, 7% of all the hospitalizations in our county are COVID related. And I think that gives you the idea that what you want to understand is how much is this impacting our hospital system. And so we're going to present that right now as a percentage, and hopefully that will give you some idea. Now, if you knew what the total number of hospitalizations were, you take 7% of that, and it'll be the number of COVIDs. But even that changes. So we think this is an adequate way, hopefully, to give you what you need to understand as far as what that impact is. Hopefully. Okay.
Closing remarks.
Closing
and then we'll do
remarks.
Resources.
Well, I've been talking through this whole thing. I'm sorry. Justin, why don't you start?
Listen, so what I've been saying the whole time to everybody is, this is a health department-led response supported by Homeland Security and Emergency Management. So we do response. That's what we do out of my office. But I knew before this started, really, when we started noticing that this was happening across the other side of the world, that it was my job to support Dr. Mercatante and her staff with functionality, with staffing, and with the EOC. And so we talked a lot, and I said, how can I help you do what you do? And it was my job to support the community, support the health department, and do what we do out of the EOC. So it's my pleasure to do that for you. And for the community, I know that we're in for kind of a long road here, but I can't tell you enough how proud I am to serve St. Clair County, and you all have done a phenomenal job, and I just ask that you keep it up. There are many challenges ahead. We are all going to have to work together to do this, and just keep up the really, really good work. I know that obviously we've had quite a number of people suffer through this disease. Unfortunately, and with sadness, we've lost a few of our community members, and that hurts deeply. But just please stay the course. We will work hard to get our economy back here in St. Clair County, and the team here will work with you to do that as much as possible. So please just keep working hard and stay safe, and let us know if there's anything we can do to help support you. And Doc?
Yeah, so I'll mirror that. This has been an unprecedented event for all of us, and we've stumbled along the way. We've tried to figure out the best way to provide information. This is a great tool, but certainly put your questions into that COVID-19 at stclaircounty.org. We'll keep trying to do what you need us to do. We really are here to try that. And with that, I want a big shout out to our community partners. So we have now a COVID-19 support hotline for mental health issues. That's COVID-19 support at sccmh.org. That's St. Clair County Community Mental Health, scc3cs.mh.org. And we'll put that up because this is hard. This is really hard on everybody, and I think it's particularly hard to think about how hard this might be for some of our more vulnerable people who are already struggling to begin with. I every day think how grateful I am. I get to go home to a home with 3 bedrooms and a separate place to sit and watch TV, and not everybody has that. So I just want to make sure that you know that. And now we also have a great resource guide. It's CSCB info. Oh my gosh, I'm sorry. CSCBinfo.org. It's a great resource where you can find everything you're looking for: food, transportation, all the things that you're struggling with non-medically. And then, as I mentioned before, send any concerns or questions you have to COVID-19 at stclaircounty.org, and we will do our best to respond to your needs.
And we'll try to do this weekly.
And we will try to do this weekly. So
Yes.
Thank you for our team to set this up.
And
Okay.
And one final thing, we could not do all the community outreach that we do without all of our partners on the CSCB, and so I want to do a special shout out to them. We asked them about 10 days ago to please help us with putting together this resource. So for our community, please take a look at this website, the CSCBinfo.org. There's
Phenomenal
pages
list.
full of phenomenal resources on there.
Yeah.
So take a look at that if you get a chance. Thank you all very much for today.
Thanks a lot.